George, no, and George, so George is trying to get a hold of her to see if she's... This is the Stonewall County Hospital District Board of Directors meeting on April the 6th, 2026 at 5 p.m. And we'll start off with the invocation. Belinda?
Yes, ma'am. Our most kind and gracious Heavenly Father, we just thank you for this beautiful day. Lord, we thank you for each blessing that you give us. Especially, Lord, we thank you for the rain. And we ask that you just please send us more. Now, Lord, we ask that you be with those who need our prayers tonight. For those that are sick, we pray that you just heal them. For those that lost loved ones, Lord, we pray that you just comfort them as only you can. Now, Lord, we just ask that you be in our meeting tonight. Help us to take care of the business that we were elected to do. Forgive me where I failed you. For all these things, bless in your name. Amen.
Amen. Everybody will join us in the Pledge of Allegiance to the U.S. and the Texas flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you.
Lou, can you hear us now? Lou? I'll work on this.
Okay. We're going to do roll call. Line item 4, Belinda Page is here, Claire Clark is here, and I'm here. Absent is Renee Spikes and Ruthie Elkins. And visiting with us today is Edmund Lucas, and I will be introducing him a little bit more here in a bit. Next on the agenda is the minutes. The board of directors have been given the minutes earlier last week or later last week and have had an opportunity to go through them. Does anybody have any changes? There she is. Yay. In attendance is Ruthie. Anyway, the minutes. We've had a chance to look at the minutes. Does anybody have any changes? Anything on those? Okay. Do I have a motion to approve them?
Make a motion. Oh, I'm sorry, Claire.
I have a motion from Belinda. I'll second. And I have a second from Claire. All in favor? Any opposed? Motion carries. Next on the agenda is the public comment open forum, and I don't see anyone here, so we'll just go ahead and go from there to line item 6, which is district reports. First on the agenda is line item A, board member reports. Does anybody have anything? No? I have a few things. So the Texas Healthcare Trustees workshop on March 27th, 2026, Belinda Page, Claire Clark, myself, and government staff liaison Mary Ellen Coates, who was in attendance. We were there covering board's role in quality, patient safety, and quality of board effectiveness, structure, reporting, and communication, and all the attendees were very positive in what we got out of it. It was a good session. This is Ruthie's last board meeting.
Yes, it
and
is.
We are so happy you are here, and we will miss you for sure.
I flew from Abilene.
You flew from Abilene. Well, we're glad you're here for your last board meeting. And then I want to introduce Edwin Scott Lucas. We call him Eddie, and he will be filling the unopposed seat for the 2026-2029 term. He, along with Claire Clark, will be sworn in at the May board meeting, which is on May 11th. And then I would have 2 shout-outs for the board report. The first is for Juana Rojas. She's an amazing member of the SLC housekeeping team, And Juana has been proudly serving the Stonewall Hospital District since August the 13th. And for more than a decade, she's shown a true dedication that looks like she's just excellent, absolutely excellent. Her hard work, reliability, and positive attitude shine through every day. She takes care and pride in her work, and it shows in the care and cleanliness and comfort she provides the residents and staff. Juana consistently goes above and beyond, and her commitment to strong work ethic makes her a great example for all of us. We are incredibly grateful for her service and the heart that she puts into everything that she does. So thank you, Juana. And then the second person that I would like to shout out is Angie Malloy, who shows us what excellence looks like as well. Angie's been proudly serving the district since October the 17th, 2017, and her dedication has never wavered. She consistently goes above and beyond, exceeding expectations with positive attitude and service heart. No matter what the situation, even when scheduled changes come up so abruptly. Angie is always willing to step up, help out, and support the team without any complaint. Most importantly, Angie shows compassion and genuine care for the residents, setting a powerful example of what good really looks like in action. Her ability and flexibility and kindness make a difference every day, and it does not go unnoticed. So thank you so much, Angie. And that is and that is all on my report. Next on the agenda is line item 7B. That's the RHC report by Aaron Golston.
So for the month of March, Stonewall did see 312 patients. And then for King County had a pretty busy month for them. They had 140 patients seen versus 150 the prior week. And then at Spur, they had 118. At this time, I still haven't gotten an updated number on how many nursing home visits that Teresa and them had or swing bed visits. So I'm still waiting on those. Providers, like the visits per hour, we're seeing 0.87 to 1.32. And then our patient wait times, Stonewall was 10 minutes, and then the providers was 22 minutes, and then the Kent County nurse was 8 minutes, and the provider was 18 minutes. And with the Spur, the nurse was 6 minutes, and then the provider was 20 minutes. And then we did have at Stonewall, we had a total of 16 walk-ins. At Kent County, they had a total of 8 walk-ins, and Spur had 0 walk-ins. So.
Renee, I think approximately 6 months ago, asked for some indication of how we're doing since the clinics changed their hours.
Yeah.
I've actually got some stuff. It's behind my report in the packet.
Okay.
There is a graph that looks like this. Right there. So these are going to be some rough numbers, and the reason they're going to be rough is it's been 4 months and not the full year. But part of the problem is that the months before we did this were the slower months, so your summer months, and the months since have been the busier months. So while it looks good, this change really looks good, I do want to preface it by saying that we'll have to come back and look at it again probably in another few months to really get apples and apples comparison. So on Mondays, you can see there that we are actually seeing roughly 8 more people a day there on Mondays throughout. Well, it's just the 2. It's basically Ashmont and Spur, since they're the only ones that change times. But we are seeing more patients on those days. Tuesday, we're also seeing more patients, about 4 or 5 patients more. The same on Wednesday. We're seeing 1 additional person on Thursday, and even Fridays, we're seeing more patients than we did before.
Okay.
Now, to me, what this is basically showing is probably Fridays are not going. This will probably be a good solution, and I think our numbers will look just fine. But until we get to the summer months and see what happens, it's going to be hard to tell. And I will even tell you, last Friday was not good. We only saw, I think, total of 7 or 8 patients the entire day. But then it was also Good Friday. So how that affects, I don't know. It's hard to say. So I still think this is the right decision to move forward. And I will be 100% honest. I don't know that this has really been a positive, but I do not think it's been a negative in any way. We get a few phone calls that'll come in from time to time into the nurses station wanting to find out why we're closed because they've not heard it before for whatever reason, even though we put out a lot of information and marketing around this. And past that, probably the only bigger issue is Dr. Passman is here on Fridays, and he's asked me at times, why are we closed? But then he'll also say, yeah, I agree with it, because it probably makes good financial sense. So I still think, like I said, I think it's a good decision. I think it's a better move for us, but I think we wait probably about 8 months and get back to December and look at it year to year and see how it actually goes.
Okay, so following that, let's do a follow-up in December and see where we're at then. Just in the interest of seeing how these decisions impact this.
I agree. I think it's a good idea.
All right.
Michael, I think something that I see as a positive just because people are seeing the clinic instead of using our ER like the doctor's office. I think it supports and stuff. So I think our exchange or whatever, but I think that's what you would see as an offload if it was not possible.
Now, one of the things that was a worry when we did this, we thought we would see more visits in the emergency room on Friday afternoons. We've not. Our numbers are staying basically the exact same number in the ER. Now, we have been busy in the ER, but it's been no more Friday afternoon than it was Friday weekend.
Okay.
Okay.
Very good. Very good. All right. Next on the agenda is line item C, which is Stonewall Living Center. Cindy.
All righty. We had an excellent March. We held 48 and we had some in and out of the hospital and stuff. So our Medicare and things, our days were good. No complaints, no self-reports. Our staffing is, you're always going to have 2 or 3 positions open and things like that. We've been very successful at lowering our agency use by transitioning some to full-time and some to PRN. So you look to have as many full-time as you can, but we're very fortunate that our PRNs are picking up. So big bonus there. Original flaw, construction flaws are Cody's worst nightmare. But truly we're really at the end of what we know to be issues and stuff. So hats off. I mean, the whole department and working with them, we could not ask for better. So, we actually, have 2 showers under remodel. When the facility was first built, there were, tubs and things in the showers that had proven not to be, utilized appropriately are being able to. They're being removed. It's an excellent project. Come see us and stuff. We're about probably 10 days or so from being that done, and then our patio and stuff. So lots of really cool things going on. So we enjoyed our outings at Stanford and Walmart. We have a family that gives us a gift card to actually rent out the entire. Claire went with us. Thank you very much. The entire movie theater for just our folks. So that makes a big difference. And so the actual Stanford, the movie theater actually gave us another time. So we actually are going twice this year. So probably in the fall. As you see, our road rates and our revenue is up. Our Medicaid road rate for March was 210, and our Medicaid rate was 655. So it makes a lot. It does good when Lou can see the difference in the revenue. So overall, it was an excellent month. So any questions?
Okay.
The flowers look beautiful.
They're loving everything in it. So thank you.
Okay. Next on the agenda is line item D, Chief Financial Report, and that would be Lou. Lou, you there?
Hold on, Lou. For some reason you're not coming through. Yeah, see, my volume's fine. right, Lou, speak now. I think it's been just 12. Lou, try it now. I apologize for this. We've not had any trouble with this in months, so I don't know.
Hello?
All right.
Yeah, I just switched to the phone for audio. I don't know what's going on with the service.
Okay. Well, then everybody's just got to listen nice and quiet, because for some reason this is not in.
Right, now talk to.
No, not through the audio. Try through the other.
I get the same headphones. I gotta switch from a wired to Bluetooth if I do that. Hang on a minute.
Okay. All right, Lou, just go ahead and flip back the other direction and then just go ahead and give your report. It'll be fine.
On me. There we go. Can you hear that?
Yeah, and I'll turn you even up.
Okay.
Go ahead.
Good enough. All right. February, kind of an average month. Not great, not the worst we've had. The key things that I keep an eye on, the cash and AR. Cash was down a bit from the previous year. Did recover in March, so next month's report will be much better. Collections were down during the month of February 2026 compared to the previous year. And a property tax from the assessor's office was coming in much slower this year compared to last year, about $200,000 behind. As far as accounts receivable, it is down a bit from last year. I'm still seeing that as mostly a positive thing due to faster collections. Although hospital billing is down a bit from last year, that's kind of overcome by nursing home being current ratio of current assets to current liabilities, 1.50 this year compared to 1.44, so that continues to be better year over year. Our net loss, you'll see, was $170,000, and it's a little bit more than last year. Not completely under the ballpark, and year to date, we're behind last year quite a bit, but last year was extraordinarily good, so it's really hard to follow a really good year with a typical year. All right, looking at our numbers, cash, as I said, down a bit, but we've got slower collections, and we also have paid down our current liabilities somewhat. That's a lot of that is debt, but also our accounts payable were lower this year compared to last year. So that's all to the good. Looking at the rest of this, as of now, long-term liabilities down, paying off just as we pay off bonds and so forth, that continues to come down. Looking at income, as I said, nursing homes much better than last year. Clinic's flat, cost them down a bit in year to date. We are actually not in total billing year to year, although when you take out the adjustments, we kind of lose that. Looking at expenses, the categories changed a bit, but the total we kept pretty much in line within $3,000 per year. This year to last year, we are a bit up, but I mean, we did have the increases in salaries and purchased more supplies. And I think the biggest thing on the other category is subscription services that, access to the computer software in many cases. Looking at it compared to the budget, we were expecting a bit better. We look at, some's better. Some things were really good, some things were worse than we expected. Overall, though, it's still, it's nothing that I want to brag about, but it's nothing that I'm concerned about. I don't really have any more to present. Does anyone have any questions?
Anybody? No? Thank you, Lou.
All right, thank you.
And next on the agenda, line item E, Chief Executive Officer's Report. That would be Mike.
All right, so you're going to see a little bit of a different look this month to the CEO report. It's only one page now. I've tried to tighten it down, not do too much over of what either Cindy or even Aaron or Lou have actually presented, but there's a little bit of overlap there. But we'll just start off with the inpatient swing bed and observation admissions. We were 15 last month, which is not great. We'd like to see at least 20 admissions every month, if at all possible. Year to date, we're down about 3 patients. The average daily census, you can tell, is down 2.45 versus 3.05. If we could somehow get above 3 just about all the time, we usually do pretty good. February was actually not a terrible month for a swing bed. We're one off of the benchmark. And the thing is, this benchmark may change a little bit as I do some more research. A lot of this is based on our previous numbers, how we've done in the past, more historical. But and it's hard to actually compare yourself with other hospitals because what we do today is much different than others. As a matter of fact, our hitting almost an average daily census of 3, we're seeing more patients in an average daily census than Haskell. A lot of times we're seeing the same numbers as Graham, and Graham's got 9,000 people in their county or in their city. Then we're seeing the same number of average daily census. So we do a good job with what we're doing, but we'd like to just find a way to improve, get better. We are seeing a lot more ER visits this year. I mean, we're at 395 compared to 364 last year, 79 in the month of February. ER admission rate, I'd like to see that a little closer to the 10 mark, but 8.9 is not bad. We are over 10 for the year. ER transfer rate was 6.3 in the month of February, 8.9 for the year. Not a lot you can do about transfers because if they need to be transferred, Dr. Passman is extremely good about trying to keep folks here that he feels like he can take care of. But there's just times when we can't do it here. We just don't have the surgical, the specialists, all the other things that you have to have in the bigger hospitals. Stonewall RHC, this is one that I've really looked a lot at benchmarking and trying to find ways to improve. You can see that benchmark over on that right-hand side before the trends. This last month, Stonewall RHC saw about 310. I would like for all of our nurse practitioners to be seeing over 1 patient per hour, and really I'd like it to be about 1.2, and that's what a lot of these numbers are based on, is 1.2 visits per hour. Kent County Nursing Home saw 115. Overall, year to year, they're down. Stonewall really did have a good month. compared to the past few months, and we are above last year, but both Spur and Kent County are below last year. RHC visits per hour were at 1.12, which is actually pretty good. Year to date, we're still only at 0.96, but prior year we were 0.93. So we are improving. It is getting better. I think the nurse practitioners are really trying their best to try to get those numbers up, and so we'll continue to support them and try to help them get to where we need them to get. EMS runs were 35 this year. We've had 160 compared to 97 last year, which is actually very, very surprising to me, especially looking at the rest of our volumes. But then again, our ER visits are up. We're just not at quite as sick of folks. So I guess from your point of view, that's a good thing. Yes. From a hospital view, could be better. EMS run time is still good. I mean, we want to be below 5, but 5.1 is not bad, and being 4.6 for the year is good. Days cash on hand, as Lou said, 8 is not, it's not great. March was much better, and actually April, we've gotten in quite a bit of money this month, so we're actually much better today than we were just 30 days ago. Part of that was tied back to a few swing beds that got held up at CMS. I really have never gotten a good, clear reason as to why that happened, but we did have about, 3 or 4 long stays in swing bed that got held up. So that got cleared up, like I said, though in March and April, and we probably kind of picked up a little bit. AR days, still good. 43 is actually a good number. 39.6 for the year is better. I'm most likely that benchmark is one that's going to be changing. I found some stuff today where a national benchmark we really should be is below 40. Stretch goals for most hospitals are really in below 35, but 40 is a good number for us to be shooting for and not 50. Net revenue, not great, but we had a big pickup on the oh, goodness gracious. Just went boring. Here, I'll look at this way. Tell you exactly what it is. It just left me. Contractuals. That's what I was trying to get at. It wouldn't come to my head. But contractuals really were much higher this month, and that's really hurt us on our net revenue. It really needs to be pushing over $1 billion and really getting closer up to the 1.2, 1.3 mark if we to do really well. For the year, we're a little bit behind, about $400,000, so $5.3 million to 5.7 last year. So sure would like to see that picked up, and I think we'll see it pick up in March, and hopefully April will be really good. Operating margins still not great. I actually had a long conversation today with Steve Smith. He is one of the executive managers at Corvus about just different ways of actually trying to drive a little better margin. Our 25, negative 25 for the year is not great. 7.7 last year was much, much better. And really and truly, I don't think we're ever going to much be above or better than the negative 10. That's going to be a really good goal for us to try to stick at. And with the way our cost reporting works, being a little bit negative on that number is not bad, but it definitely needs to be better than the negative 42. Total salaries and wages, not bad right now, a little higher than last year, but still not bad after you can consider that we did give some raises this year. That 660 is probably a pretty good number for us to be trying to focus in on for the rest of the year. Labor cost as a percentage of net revenue, once again, terrible, but once again, that's because of the net revenue number being so poor. That 89, we really need to be trying. I've always said 60. Some of the research I've been doing over the last week or so, I'm about kind of a conclusion 65 may be closer to where we're going to have to be shooting as far as our goal goes. It's just going to be a hard thing for us to ever sustain below 60. I think last year we were doing really well, but part of that was we were doing really well in that revenue every month. So it was keeping us below that 65 mark, and I think that may be our better target. Agency use definitely improved from the rest of the year. You see this year we are at 24.8. We did come down to 18.8. We've talked about in the past, Cindy's got a good plan. We're going to be doing these CNA classes. As a matter of fact, that's something me and her will be working on and doing some work on this week. She got me a budget today that we think we can make work, and we'll be getting that in place. That 5% benchmark, I'm most likely going to try to get that up to 10, and we're going to really shoot to get that well below that 10 mark for the rest of the year if we can. It's going to be a tough goal to match or meet, but we're going to do our best. Going on to workforce, as you can see, this is one of the bigger changes. I don't have a ton of information here. We have it figured based on our basically benchmarks of what we've looked at for every department. We think we should be around 113 full-time employees. For this month, this is not the number of employees we have. This is the number of FTEs. So we take the total number of hours worked, divide that out by 40, and that gives us the number of FTEs that actually worked for the entire month. So we are a little bit below. Part of that was made up though with the agency use, and that's part of that reason for having that agency use, but it still was probably a little bit too much. Turnover rate, we're at 2.5. I think we had one person leave this past month or in mid-month February. And we actually don't have a lot of openings right now in the grand scheme of things. I think we've got some PRN folks, and of course, Cindy's brought up a few people in dietary CNAs and some different things, but definitely something we can get under control. Overtime, I'm definitely going to be pushing this to get to that 0.5. I know that we've talked about this in the past. I've got a pretty good plan right now, and I will be putting that in place later this month. But this is something we are going to start monitoring much closer. As a matter of fact, during our quality meetings, every department in the hospital will actually be shown their percentage of overtime, and it will be shown on the big screen to everybody. And so there'll be a little bit of competition, hopefully, but overtime is something we definitely have to keep it under control. But that 8.7 is just way too much. So moving on, this quality is going to most likely change a little bit in the next coming months. I will tell you what we've done or what I'm working on doing right now. We have not actually implemented it yet. I'll be meeting with all the directors this month. But you guys have seen that whole big sheet that we had all those PI indicators in the past. I've actually expanded that by about 5 times for the actual QAPI. That is for our internal meeting, for us to have each director be talking about the things that they're working on, the actual quality assurance pieces that they have to focus in on every month, say medication errors or something like that. That's not a performance improvement. That is actually a quality assurance thing that has to be done. You shouldn't be having medication errors, or you need to be always looking at those medication errors and trying to get better. So the directors will be bringing more to that meeting, but ours in this, for you guys, is going to be much more focused on things that truly bring risk to this district, risk to our finances, just issues that you guys then can see where our real problems are. And then one of the other ones, once I get that built, which I'm planning on having it truly in place by about the 1st of July, for them to start putting the new data in, we'll be looking at the overall score for all quality stuff. So you guys can say, is we having a real drop in quality of care somehow, and you'll be able to see the numbers there. But we'll still have these things because these are always issues. Falls with injuries, we had none in the month of February. Medication errors, we had none in the month of February. Once again, that is something I'm going to start getting a little bit more difficult on, I guess the best way to say it. We do have medication errors. I know we have them. Everybody in the country has medication errors. It's not a bad thing. It's human nature. It's just human nature. Errors do happen. And the fact that ours has been zero so much makes me feel like we're not paying a close enough attention to it. So we will be looking at that much closer in the future. Incident reports and grievances along with the hospital acquired infections. We have been collecting this data, but not actual numbers. So I collect the grievances, I collect the incident reports. Lavinda does a really good job with all of this, but we will start putting it into true data that we actually are able to report out to this committee. But for right now, I don't have that yet. Discharge planning compliance, we need to be hitting 90 to 95%, and this month we're at 80. I will say that we have a new quality person, that is Katie Bush. Lavinda is going to be stepping more into the risk management role, and so she will be backing up Katie on the quality side. But Katie's going to start spending a lot more time digging into these issues and how do we get better. And so that is one that we've already been talking about. We think we have a pretty good plan there. ER return rate was at 11.4 this in the month of February. Really our goal, our target is to be at 10. It's not a huge concern just because it's pretty close, and we're staying pretty steady right around that 10. That is a national benchmark on that return rate. Readmission rate, 15% for skilled and small critical access hospitals, and we're at an 8.3. So that's actually a really good number for us. And when you look at our year to date, it's fantastic at 1.7%. So we really do have a very low readmission rate. Medication reconciliation, that's one that we've had issues with for a while. Me and Susan have had several meetings about this, and I think we've actually got a really good plan right now. I think we've been looking at things a little bit wrong. We've been having some issues with weekend medication reconciliation. I don't think we have to actually capture it every single day. As I went back and read the regulations, she can go back and pick those up on Monday and Tuesday, even if they've already discharged. And as long as she does that medication reconciliation and it was done correctly, we're okay. If it wasn't done correctly, then we'll catch it and it'll go against us. So it's not just the fact that we didn't get to it. So that one will be corrected. Antibiotic stewardship compliance, this is still the order indication. We still have an issue there. I have told the nurses that we will get this one fixed. We will get this up above 90, and I've been told that they will get it done. So we'll see how that goes. Delinquency rate, we didn't have any delinquent charts this month. I don't think we had anything that fell out in the month of February, which surprises me. And I meant to go back and talk to Kim a little bit more about that. I noticed that over the weekend when I was looking at it, that it just was something that doesn't feel right. It's just hard for me to believe we don't at least have 2 or 3 that are a little bit more. So I will be looking at that a little closer, but I know it has been much, much better. The reports I've gotten lately have been much better, much less lengthy. And then EOC, life safety compliance is 100% and has been. But we will be looking at changing that just a little bit. I haven't even talked to Cody about it yet, but what we'll be looking at is the entirety. It's not a matter of was it done, but did the problems we identified, did those get corrected, and what does that number look like? So you can see the key summary. I've already basically gone over each one of those, but I think this is a good report. But I would like to hear from you guys if you like this the way it is. And in the future, probably if it's green, we'll just skip right over it. But I wanted you to see it today and kind of have an idea of what it is. We'll be talking briefly about yellows, and then the reds is where we'll spend most of our time because that's where we're at our largest risk.
The course that we took the other day, actually we talked about this in length. And one of the things that I'm looking at here, there's 3 instances where you basically have a flat line for 6 months. That means we're not looking at something.
Well, you have to remember, falls with injury rate, it's per 1,000 patient days. And if you really do not have a fall with injuries, which we have been very lucky lately, we've not had a lot of falls with injuries. We have had some falls, there's just no major injury that go with them. The medication error rate, like I said, it being zero like it has been is something I know it's just not correct. There's something going on there.
Right.
I've talked to the nurses. The nurses can change times when they give something a little later, and they just retime the entire thing. It's not necessarily wrong, but it's also not necessarily right based on this. So Susan is really trying to figure a way of actually capturing a few issues that we know we have.
Okay.
As a matter of fact, Heather had a medication error on her desk today that she was trying to kind of work her way through and figure out what exactly happened. So I know we will at least have one this next on the April calendar. So, but that's the stuff that we're going to be looking at. I can't remember the exact number, but the IHH came out years ago and it was like some ridiculous number. Like there is, for every patient day in a hospital, there's like 2 medication errors made per day. Some ridiculous amount. And that's been 10 or so years ago when that came out, maybe a little longer. And I don't know if those numbers have ever changed significantly.
Well, I do like this, the color coding. That really does help a lot. Gives us a little more to focus on. Okay.
Can you give us a report on the apartments?
They're done.
They
They're
are?
pretty much done. They're done. Then we were right there in a few little things we was working on this last week. So
Has everybody gone to see the apartments?
yeah,
Bob, I'll make a,
Very neat.
Thanks, Ellen.
well, we've already. Go ahead.
The feedback's been great. We've had employees email us and tell us how much they appreciated that. They work at other hospitals and they don't have anything like this, and so they're very appreciative. So hopefully that helps us with retention and the employees know that we're doing everything we can to help take care of them.
Excellent. Done good. It's really nice.
excellent. Okay, well, that's all of the district reports. Do I have a motion to accept the reports?
I'll make that
I
report.
have a motion from Wednesday. Do I have a second?
I'll second.
I have a second from Claire. All in favor? Any opposed? Motion carries. Next on the agenda, line item 8, old business. Line item A, Crusoe Data Center abatement application.
So I have made sure and sent all of this information on this Crusoe Energy Systems abatement application. This actually on next Monday, the county will be voting on the application, and they will also be voting to rezone that out there where they're going to be building that. They already have the land. They've already got it in place. They've started wells out there and everything else. I think they've started at least running some test wells to make sure they can get additional water. They're trying to find water that they can use for bathrooms and systems like that, but that's the only water that they're going to be pulling that away. The way the entire system works, as a matter of fact, I even put in here an information sheet so that you guys can understand it. I've had some negative comments about it. I've had some folks talk to me about it. The negative comments have been things like, well, they're going to use all of our water. Well, this has really nothing to do with us using our water. They've already got contracts set up with Hamlin, which they get their water from Abilene. They will be filling up that entire system. It's 1 million gallons to fill it up, but they fill it up one time, and then they run it through there. It's just a closed system that will actually not have to be filled up again. I thought it had to be filled up like every 10 years, but I was actually talking to some folks from them. They said you can get a little bit of loss due to steam and some other things, but you just never have any real loss in the system. They do top it off just like you would with your radiator on your vehicle. We have already started talking to them about what would it look like to actually try to bring more water into the county, either through working with our legislature and potential lake, potential desalination plants, whatever it takes. That since that is kind of the big concern on everybody's mind, what are things that maybe they can help us with? And they've agreed. They're going to start looking at those things. And I am going to be talking with them a lot more about what are things that they could do even more to help with that situation. If they can, it'll be a huge boon. And there's really no other negatives towards that. The other big negatives that we've heard all over the place is crime is an issue. It won't be here because, for one, its location, those folks will go much more towards the Abilene area as far as the ones who will be here during construction. The other thing is that by having this additional revenue coming into the county can then afford to actually hire deputies that were already needed anyways. We just didn't have the money to hire them for a lot of other issues like cattle trucks flying through town at 80 miles an hour. You know, the crazy stuff that does happen now will continue to happen, and we do need more deputies, and I think it'll be a huge help. We've heard from other places that it's an eyesore. You couldn't get more far away from civilization than this, just about. It's going to be really difficult because there's nobody driving up and down an 1835 section of highway. It's about as far into the sticks and rocks as it can be without falling off the earth. It will bring jobs, about $8 million in annual payroll. That's a huge boom for us, and hopefully we can, if we start getting some money in, we can start pumping that in and try to keep those folks here, which will be a huge help. Community impact. There's so many more things here, and just really, I would honestly tell you guys, you know how I'm absolutely transparent. If there's a real negative, I don't know what it is. I really don't.
The only negative that I can think that anybody might have a valid point, and that's water. But if they're willing to step up and help with that situation and go to the legislature and talk to the government, I'm all about it.
Yeah. And even the water they're getting it from Abilene. They're not getting it from us. They're not taking anything from this county that's going to hurt us in any way, shape, or form. I've actually been told, well, they'll pump and they'll poison the water supply. They don't do that. It's not anything they do. They have no way of even pumping that back into the earth.
Oil wells have already done it.
Yeah, and the oil wells have already done that. We've lost all of our fresh water in this county. All the family water is basically not great as it is. So, like I said, I just don't see a negative. All we're doing tonight is approving the application. There's still some additional things. Of course, we have Jake Lettery is still our attorney, dealing with all of our abatement issues or abatement contracts and negotiations, and he's going to continue to do that for us through this entire project. I really feel like this is a great deal. The numbers that we're seeing right now, the hospital, the county, just on one building, we're going to build 4 of them, but on one building, the county will be getting roughly $11 million a year in taxes. The county's entire budget right now is $2.2 million. Our entire budget runs about $14 million a year. We'll be getting $8 million off this per year on one building. If they build all 4 like they're planning, we'll be getting 32 plus, because they're also building gas power plants. They're doing some other things that are in here. And I mean, we've been trying our best for 30 years. I mean, when I was here in EMS 30 years ago, we were trying to find industry for this county and couldn't find anything. It was just an absolute wasteland when it came to trying to find people to come here. This is the first real opportunity I've seen for this part of the world. So I think we go all in and do everything we can, because this will basically sustain this hospital being in Stonewall County for the next 50 years.
Yes. Yes. And that's what this board is here for, is the financial solvency of this hospital. And I've looked at the AI, I've looked at the numbers, and I think we're moving in the right direction by approving this. But, any questions? Any thoughts? No? Do I have a motion to approve the abatement application for Crusoe Energy Systems, LLC?
Make that motion.
Motion from Belinda. Do I have a second?
I'll second.
I have a second from Ruthie. All in favor? Any opposed? Motion carries unanimously. Okay. Very good. Next on the agenda, line item B, policies, review, and approval. Bereavement policy is first.
All right, so I was getting ready to actually put out the new employee handbook, and one of the things we actually had one of our employees whose family member passed, an in-law family member passed, and it hit me while I was going back and looking at this that I made a mistake, and I feel like the mistake is I had down immediate family members as spouse, child, parent, sibling, grandparents, grandchild, but I didn't have the in-laws in there. I had that as extended family. And I got to thinking about if it's your spouse's parent who passes, you're going to be there with your spouse, and we should allow the spouse to be there with them during that sort of a situation. I would hate to think that, well, because my bereavement is only half the amount, if my wife needed to go, I need to come back early to get back to work. And so what I did is I changed it to include in-laws, son-in-laws, daughter-in-laws, mother-in-laws, brother-in-laws, grandparents-in-laws to the immediate family list, and basically took out the extended. I don't believe that aunts, uncles, cousins, things necessarily need to go in there, and I'm not trying to be hard-hearted about that, but in most cases, if it's an aunt, uncle, or something like that, a cousin, there's other families that need to take care of the business of them passing, their probates, their other things that happen. It's not going to be me doing it for my aunt or uncle in most cases. I'm not going to say that's not always, and we do have a stipulation in here that says if there are circumstances that lead you to needing more bereavement because of, let's just say it's an aunt of mine and I'm the only nephew and I'm taking care of all her finances. Well, that would be an extenuating circumstance, and we would go ahead and probably okay that. But that's really what this is. It's just to add the in-laws into the immediate family.
I agree with that, because they become a part of your family when you get married.
They do.
You're there. So, anybody have any questions on that? Thoughts? No? Okay. Do I have a motion to approve the policy to extend?
I'll make that motion.
I have a motion from Claire. Do I have a second?
I second.
I have a second from Ruthie. All in favor? You approve. Any who say no? Motion carries. Next on the agenda is 2026 employee handbook.
And there was one other change I would like to make in the handbook. Basically, this is not a policy currently. I could write a policy, and I have no problem doing it. It is in the handbook, which I've already passed out. But what I would like to propose is that if an act of God happens, we have an ice storm, we have a tornado, we have a power outage of some sort in one of our clinics, and we deem it necessary to close down for those days, whatever the reason is, that we pay the employees. Not their fault. They are there to come in and help if they can, but I think we should pay our folks if they need to be off. I also believe if you do have to come in, so your critical staff, nurses would be on this maintenance crew, and they came in and cleaned up at that ice storm, we then pay them time and a half to be here, which is something we've not done in the past. But you saw the job these maintenance guys did. They got this thing back in shape to where we could actually be here. And those nurses, didn't matter day or night, we never had a question whether they were going to show up. And so I would like to just propose that we pay staff regular time if we have to call them off due to an act of God, and that we pay time and a half for the critical employees we ask to come in and work. Okay, that's it. And what it is.
Any thoughts on that? Questions? I think it's a good idea. I do. You can't predict what's going to happen as far as weather and what have you. So, and it's not by any fault of the employee. I mean, if they call and say, "Well, I can't make it because of," that's one thing. But they can make it here and they're still available. Absolutely. So.
Well, the other thing, it doesn't put our staff into a position where they feel like I can't afford to not work.
Exactly.
But just like if we'd have tried to open up this clinic over here and some little person that's 90 years old on a walker trying to get into the RFC and then they slip and break a hip, that's our fault for not making it safe for them to be here. But yet, I don't want the employees to feel like, well, you just can't do this to us because we can't afford to be on. Right. And so I think it's the right thing to do. I mean,
okay. So, do I have a motion to make this change with the act of God? I think the act of God stipulation to the 2026 employee handbook.
I'll make that motion.
I have a motion from Belinda. Do I have a second?
I'll second it.
I have a second from Claire. All in favor? Any opposed? Motion carries. Next on the agenda, line item 9, new business, resolution to change the signature card for the resident fund. And this is to remove 1, Ronald McDowell, and 2, Faye Jones.
so it's even the ad, Lachey Travel, Diane Weaver, and Cynthia Rogers. I thought I had done this, to be honest, and realized a few weeks ago that it wasn't done, so. But we changed one account, but I guess I thought they were both together and then figured out that they aren't. This thing has not been changed since like 2002. Not been updated, not been changed, not been anything. So, we are going to be paying part of the, awning or the pergola at the nursing home with this money, and that's when we realized that we don't even have access to that money. We put it in, but we can't get it out.
Gotcha.
So that's all it is. I've actually gone ahead and done a resolution. It says, whereas Stonewall County Hospital District has new employees and others have left the district, and whereas the Stonewall Living Center resident fund account signature card with First National Bank I'm authorized to communicate these changes to First National Bank Astronaut and to execute the necessary documentation to a word that doesn't make any sense, the update and the signature card. This resolution shall take effect immediately upon its passage, dated 6th day of April 2026, and then I'll take it tomorrow. But I will get this corrected.
Okay. So, do I have a motion to change the bank signature cards, adding to the signature cards Cynthia Rogers, Diane Weaver, Shannon Trammell, and then to remove Rhonda McDowell, Faye Jones, with our chief executive officer going as the authorized person to represent us.
I'll make that.
I have a motion from Claire. Do I have a second?
I second it.
I second it from Linda. All in favor? Any opposed? Motion carries. Next on new business, line item B, Paylocity, flexible spending account and compensation reports.
The first one is, I've had a chance to speak with Paylocity. That's the company that does our payroll system. They actually have the ability, I don't know if any of you guys have ever used FSA accounts, but they do have the ability to do that through our current system. Basically, the way it works is as an employee, I can say I would like to put up to as much as, I think, $3,400 is the max you can put into it. But you were able to put that onto a credit card pre-tax at the first of the year, and you will get the credit card and you can use it for anything that's tied back to medical, so medications, prescriptions, over-the-counter medications. You can use it for going to the chiropractor. You can use it to, there's just a whole host of things that it can actually allow you to do, and you get that at tax-free. It works great if you have like prescription medications and you know you want to be able to pay your prescription medication and it's tax-free. You don't have to be worried about turning something in the first year or at the end of the year on your taxes. It understands if you use a credit card at the grocery store, it understands the difference between ibuprofen and bananas. It'll tell you you can't use it for bananas, but you can use it for here, and they'll ask for cash for the other amount. The charges, they actually charge us a $75 monthly fee to make sure that this happens as a minimum. And then outside of that, it comes out to $4.50 per member, per person who signs up for this. There is an annual renewal fee of $125 to us as a company, and there's a one-time fee of $500. You can read through this entire thing, but because we don't have to pay FICA on that money, we basically can make that money up if we get about 15, 16 employees sign up for this. It'll actually be a complete wash on how much it costs us. It'll be, because of our savings on FICA, will be basically the same thing for all of our ongoing charges on this. I actually have had this in most of the other companies I've worked for. I've always liked it. I used it for prescription medication. If I knew I had some kind of a surgery coming up or something, a procedure, teeth cleaning, whatever, I could set aside so much and then I can use it for all of those things, and it's all pre-taxed. The other thing is, and I don't think this will be a problem for us, but I have seen it in other companies be a concern. That money is put into the account at the first of the year, meaning you can use the full, like if you put in $3,400 and you're going to have surgery in October, you can put all $3,400 of that down on that surgery, and then we'll just take out the money all year long. Now, if that person was to leave, we're just out of luck. That money's gone. But in that same respect, if that person leaves $10, $15 at the end of the year that they don't use, it comes back to the district and we just keep that money. Okay. So it's kind of a wash there on that side of things. We may have some that will do that, use it all up if they know they're leaving and they'll take advantage of it. But we'll also have a few people who they don't spend $2 here or $5 there, and it'll add up over time. That we'll get part of that to offset the other. Like I said, I've always had this before in nearly all the companies I've worked for. I've always used it. I think a lot of people have, and it's actually a really, really nice benefit.
Okay, can you use it on deductibles for your insurance? You can.
Sure can. Anything medical.
Okay. That actually is low cost, $500 for a setup fee and $75 monthly minimum. That's for everybody.
It's $450 a month per person, but
Yes.
75 minimum. So if you had 100 people doing it, it would be $450 a month that you would be paying. But like I said, then you're going to make the money back on the FICA that you didn't have to pay.
Gotcha.
Taxes.
Okay. Well, that sounds like a pretty good deal. I know a lot of people are very fond of the flexible spending accounts for that kind of reason. So, any questions, any thoughts on this? No? Do I have a motion to accept the Paylocity flexible spending account?
I'll make that motion.
I have a motion from Ruthie. Do I have a second?
I'll second it.
Seconded by Belinda. All in favor? Any opposed? Motion carries. The compensation report is the same.
No, compensation is separate.
It's separate. Okay. So then we have compensation reports.
So on the compensation one, what it is, it's really much more for, well, it is for the employees, but it's also much more probably for me and Connie. It allows us to be able to look at, when was the last time they had a raise? How much was it? Percentages and all kinds of stuff. For the bonuses we do, Connie will be able to go on there, run a full report that shows everybody who was hired in this month and how long they've been here, and then it'll actually tell her exactly how much that we owe them in a bonus, and then it'll calculate everything for us. It just takes care of all of that. The other really nice thing that I really liked about this is at the end of the year, and I can do this any time, but at the end of the year, I would like to be able to give somebody a raise and then say, you were making $20 an hour or $30 an hour, but really and truly, you also get from the company this much for your insurance and this much is going towards your retirement, what we're matching. And you can actually show them you're really making, $40 an hour, not $30 an hour working here. Which is, sometimes that can be looked at as, I don't care, it's just what do I get in check. But it does make a big difference. We've had people leave here, go to other facilities as like either PRN or as self-contract or self-employed, and then they don't realize that all of those insurances, all of the taxes, they have to pay self-employment tax, they have to do. That actually happened to us this past year with some of our CNAs, and it was just a bad deal for them. And they did get paid a lot more money per hour, but that all disappeared when they had to pay their taxes and everything else. And so this allows us to be able to give that to somebody and say, this is what we're actually paying you an hour. And I like that idea. I think it makes it much more apples to apples with where they could go somewhere else or something. So
I'm a big fan of this. I've always been a fan of this. My ex-husband worked for the police department in Austin, and they always gave them a itemized everything that you get by being a part of that organization. And it's quite an eye-opener because you end up going, okay, I'm getting quite a bit more than I really thought. It wasn't just my monthly pay. So I think this is a great idea.
And this one is considerably cheaper. It is $750 to be set up. They have to do a little bit more work, I guess, on the front end, but it's only going to cost us $1.40 per employee, and that's a flat fee. So we have 167 employees right now. It'd run us about $233 a month for the whole thing.
Well spent, I think. Any questions? Any thoughts on that? No? Do I have a motion to accept the compensation report from Velocity?
I make that motion.
I have a motion from Claire. Do I have a second?
I second.
I have a second from Ruthie. All in favor? Any opposed? Motion carries. Next is line item C on the new business, Gallagher contract for master plan.
All right, so Gallagher Construction has been doing a lot of our master planning for us, and they've done it for free. They've actually come up with figuring out how much square space we really should have, how far under we are in some areas. They truly are a master planning company. That's what they really specialize in. They can do some other things, but this contract is specific to helping us as we move forward with doing some work. Potentially, if we do get the AI data center here, if we do add assisted living, which we've talked about in the past, they're the ones that will be there to help us put this together and not allow us to get in a situation where we have a nursing home built that has 7 less rooms than it should have had.
Yes.
And the air conditioners went to nowhere.
And bathrooms that don't work.
And bathrooms that don't work, showers that don't work. So that would be what this company's here for. You can look at the second page here, Exhibit B, that they only work on if we decide to do the project. We don't pay them anything if they don't. But if it's a project of under $500,000, it could be as much as 10% for them to basically build it for us and put everything together, help us get the architect firms and everything else. But anything over $12 million, it would drop all the way down to 3%. This is the same company who is helping the school with their construction right now, and that's kind of how we got connected to them. I will say I am very impressed with them. I think it's a good company. They actually contacted us and is going to even donate some money to the Ashburn ISD Foundation. Like I said, it's a good company, I think. From what I can tell right now, if this whole thing falls through for some reason, which I can't imagine, and we didn't get the AI data center, we didn't do anything else, and now we're just trying to figure out, are we going to do anything? We could still use them. It would be on a limited basis and only for whatever we're using. It's not something that really costs us anything. It's just having them available to get that for us if we do it. And so that's it. We'd just like to get the contract signed and take it away.
Well, this falls into what we do with strategic planning. And I think it's a good idea to have some of the experts come in and help us with expansion and or whatever it is that we need as we go along, especially when we're talking about the AI data center and we're talking about the solar project. We need experts to help guide us in that way. So I think it's a good idea. Any thoughts on it? No questions? No? Do I have a motion?
Make a motion.
I have a motion to accept the Gallagher contract for master planning. Do I have a second?
Second.
I have a second from Ruthie. Ruthie, all in favor? Any opposed? Motion carries. Next on the new business is line item D, new Equinox for 250K mile traverse.
So I told you guys last year that we would be bringing these cars and trying to kind of rotate them every year or so. We do have a Traverse that has 250,000 miles on it. We'd like to trade that off and get a new 2026 Equinox. We found one. It's $37,588, and we would finance it again through the bank here, and the way we're paying it out over the bank, and truly deducting it out over 3 years or so. But that's what we needed to do this year. We've got another Equinox that has 180,000 miles, 195,000 miles, and that'll be the next one we bring in next year. So That was what we decided last year, is to start trying to kind of stay ahead of that and not all that all of our stuff get old and run down.
So for those of you who weren't here when Michael first got in as our CEO, we had vehicles that were driving on a wing and a prayer. And so we're slowly getting it so that we get the old ones out and we bring in the newer models so that we stay fluid in our ability to take care of our patients. And this is part of that. So do I have a motion for the acceptance of the new equinox? I have a motion from Renee. There you go, Renee.
Are we taxing them,
From-
Michael?
Huh?
Are we taxing them? Well, that makes a big difference.
It does make a difference, for sure.
I have a motion from Ruthie. Do I have a second?
Okay, I'll second that.
I have a second from Claire. All in favor? Any opposed? Motion carries. Line item 10, adjournment. We have, our next meeting will be on May the 11th, 2026. Do I have a motion to adjourn? I have a motion from Belinda. Do I have a second?
That's it.
I have a second from Ruthie. All in favor? Any opposed? Motion carries.